Toots.
Hi.
Providing privacy for my patient and doing my hand hygiene. Hi, Ms. Toots. My name is Raven. I'll be the nurse for today.
Hi, Raven.
Could you please state your name, your date of birth for me?
Sonia Toots, November 3rd, 1975.
All right, great. Can I just check your wristband and make sure? All right, perfect. All right, Ms. Toots. So the doctor has some orders for a respiratory and cardio assessment, and then we also just want to go over some safety rules for the hospital as well. Okay. So first things first, we want to make sure that you have bed rails up to make sure that you don't fall or you sleeping, you don't roll off the bed.
Okay.
And we also want to make sure that you have your bed at its lowest position so it's easier to get it in and out of the bed.
Okay.
Also, you want to make sure that your wheels are locked on your bed so it doesn't move when you're trying to get out of the bed as well. Having non-skid socks or shoes will be very helpful for when you're getting up and moving around. You're not going to slip or slide on the floor.
Okay.
And then also, we want to make sure you have some type of identification, which is your wristband. We'll check that just to make sure, or we'll scan it as well to provide medication or vital signs as well. And then we have your call light. This is what you use to, anytime you need help or you need us to come in and help you with anything, you can just hit that button and we'll come in. And if you need me specifically, if anyone comes in, they'll just come and get me, okay?
Okay.
All right. Is there any questions with the safety precautions and suits?
No, you made it very clear.
All right, perfect. Okay, so now we're gonna move over to your cardio assessment. So first things we're gonna do is just gonna set your bed back to semi-phalanx position at 45-degree angle. And I'm just gonna take a look at your jugular veins. Okay, we're just checking for any distension. So could you turn your head this way? Perfect. And I'm gonna come on the side and keep turning it to your left. Perfect. All right. So I don't see any distension on your jugular veins, which is great. All right, and then now we're just gonna move over to palpating pulse. So we're just going to check out your dorsal pedis, which is in your foot, the pulse, and your anterior tibia, which is kind of more in your inner ankle.
Okay.
And then we're going to check out your radial, which is in your wrist.
Okay.
So can you flip your, perfect. And all I'm doing here, Ms. Toots, is just rating how your pulse feels to me, okay?
Okay.
Great. This is a 2+, meaning it's a normal pulse rate.
Okay.
Do you mind taking your shoes off for me,
Sure.
Ms. Toots? Thank you. Great. Your dorsal pedis is also a 2+ normal pulse rate. And now we're just checking for that posterior tibia. Right, perfect. And that's also a 2+. And then also there's other pulses, which will be your popliteal, which is behind your knee, your femoral, which is in like your groin area, your brachial, which is here, your axillary, which is under your armpits, and then your carotid arteries on each side of your neck. Okay. All right, so now we're just going to move over to assessing your capillary refill. So we're just going to check to see if your blood is refilling every 2 to 3 seconds at each of your fingers.
Okay.
So I'm just going to push down, let go, and release. Perfect, great refill time, okay? Okay, so now we're just going to inspect your upper and your lower extremities for any edema, okay? So any swelling in your arms or your legs, okay? So we'll just start up and move our way, down and start move our way up, okay? All right, perfect, Ms. Toots. I didn't see any swelling, okay?
Okay.
All right, so now we're just going to take a look at a sound to your, we're going to do oscillating your heart sound.
Okay.
So we're just going to check, and I'll tell you each sound that I'm going over, okay?
Okay.
And I'm using the diaphragm part, and then we're going to turn over to the bell, which will help me listen to more murmurs, okay?
Okay.
All right, verbalizing, putting the stethoscope in contact with the skin. This is your aortic, your pulmonic, your herbs. Can you lift your breast for me, please, Ms. Toots? Thank you. Your tricuspid and your mitral duct. Perfect. Your heart sound good to me. I'm just going to turn over and listen to it on the bell side
Okay.
as well, okay? Once again, your aortic, your pulmonic, your herbs. Can you lift this breast for me? Your tricuspid, and your mitral. Alright, I didn't hear any nervousness too.
Okay.
Alright, so we finished with the cardio assessment, now we're gonna move over to respiratory, okay? So I'm just gonna ask another question about shortness of breath, or if you've been coughing and have any sputum or mucus coming up.
No.
Okay, excuse me. Alright, and now Ms. Toots, I'm just gonna take a look at your respiratory rate.
Okay.
I'm just gonna place my hand on your shoulder, okay? Alright, good. Your breathing, your respiratory rate is within what we call eupnea, which is from 12 to 20, and I got 18 for your respiratory rate, okay? And your breathing is regular, it's not shallow or anything, okay? Alright, so now we're gonna escalate your breathing sounds, so I want you to just take deep breaths, I'm gonna
Okay.
listen to each lobe, okay? This is your right upper lobe. Left upper lobe. And I am verbalizing that the stethoscope is in contact with my patient's skin. Left lower lobe. Right lower lobe. Good. Those sound clear. And we're also going to do your lateral, which is your side. So I want you to place this arm across your chest. I'm just going to check this side of your lung. Deep breaths, please. Great. And we're going to do your other lateral. Wonderful. Okay, so do you mind just sitting up in your chair? I'm going to do your anterior. So we just did your posterior side. Now I'm going to do your anterior.
Okay.
I lied. This is your anterior side. I'm going to do your posterior.
Okay.
All right, deep breaths. There's your left upper lobe, right upper lobe, right lower lobe, left lower lobe. All right, Ms. Tooks, your lungs sound very clear. Alright, so now I'm going to educate you on the cough and deep breath turn.
Okay.
So this is mainly for patients who are kind of bed bound, can't really get up and move. So if every 2 hours you would turn to your right or left side and you'll take a deep breath in and you'll cough.
Okay.
And it just helps to loosen up the mucus in your lungs area.
Okay.
So could you demonstrate that for me, Ms. Toots? Just turn to your side and cough. Great job. Alright, great job. Alright. So another exercise to help with just getting the mucus loose in your lungs is using an ascending spirometer.
Okay.
So with this, Ms. Toots, you're gonna take a deep breath, hold it for 2 to 5 seconds, exhale, and this will help with exactly loosening that mucus in the lungs. And you will do this every 10 times an hour.
Okay.
Could you just do an example for me, please? All right, great. And commercial break would probably be a good time to do this. So
Did you say about 10 times an hour?
Yes.
Okay. All right. Great.
All right, Ms. Toots, is there any questions right now?
No questions.
All right, so we're going to get over your assessments to the doctor, put those documentations in. You have a good day, and thank you so much.
Thank you.
You're welcome. Providing hand hygiene and privacy for my patient.
I was just about